This presentation is reporting on the impact of COVID-19 on organic farmers, results of a national study of USDA certified organic farmers. 62% of certified organic operations worldwide are located in the U.S. Most are small farms producing fresh foods. Demand has been steadily rising and products are widely available. COVID-19 affected food availability, industry practices, and consumer behavior. At the height of the pandemic, sales increased almost twice as fast than the previous year. And when the U.S. lost 22 million jobs between January and April 2020, farmers were impacted. But despite limitations, farming, an essential service, remained active. However, to comply with CDC recommendations, producers reduced their workforce and implemented prevention practices. Workers reported reluctance to test for COVID-19 for fear of losing their jobs, and mixed messages hindered prevention efforts. There's also evidence that the pandemic intensified flaws in our healthcare system. The study aimed to gather data on demographics, behavior, prevalence, and healthcare delays to examine levels of risk and understand factors that may influence decision-making. Only a snapshot of data exists for this population, but this body of knowledge is growing. The National Organic Farmer COVID-19 Survey is a theoretically informed cross-sectional survey developed with expert input. We conducted descriptive correlation and regression analyses using SPSS 25 and calculated Cronbach's alpha for a 6-item prevention scale. Table 1 is a summary of reported demographic characteristics. Some characteristics are consistent with existing surveillance systems: place of birth, race, sex, farm size, and age. Education level has not been collected elsewhere. Over 1/3 of respondents experienced non-COVID-related delays in healthcare. Overall COVID-19 prevalence was 9.6%. Overall prevalence for producers alone was 6.4%. Prevalence on only 2 demographic characteristics were statistically significant. Higher infection rates were reported by those with less than 4 years of college education and those with larger farms. Cronbach's alpha indicates a high level of consistency among the 6 prevention methods. Of the 6, respondents did best following the 3 most highly publicized prevention methods. Correlations were observed between following prevention methods and several demographic characteristics. In the regression model, when controlling for farm size, only sex and farm size were statistically significant. When examining the odds of experiencing non-COVID-related healthcare delays, being female was the only significant demographic characteristic. In Table 9, women who were married or cohabitating had greater odds of experiencing non-COVID-related healthcare delays. This study generated much-needed data and provided valuable information that may be essential for allocation of resources, injury prevention, health education, and policy aimed at supporting and promoting organic agriculture. Self-reported confirmed cases among organic producers in this study was lower than that reported among agricultural producers and farm workers in other studies. Overall, household prevalence of COVID-19 was consistent with infection rates observed nationally. Variation in prevalence estimates suggest the need for more research in this area. Correlations between the frequency of following prevention methods and COVID-19 prevalence suggest that mask wearing was a measure of prevention. Although there were significant relationships between the frequency of following prevention behavior and demographic characteristics in the correlation and regression analyses, those with greater significance, gender, race, and farm size, should be examined further. Mixed messaging and contextual factors, including work environment and socio-political discourse, may have contributed to individual perception and resistance to practices. Further studies should include questions about vaccine hesitancy. Although the real impact of the pandemic on morbidity and mortality is still unknown, a high percentage of participants in this study reported experiencing disruptions in healthcare services. Of relevance is that female producers and those who were married or cohabitating were more likely to report non-COVID-19 related healthcare delays. Organic producers reported high compliance with 3 of the most highly publicized practices: social distancing, wearing a face covering, and avoiding contact. This study collected national data on healthcare delays among organic producers and identified sex differences in non-COVID-19 related healthcare delays. While the results of the study are consistent with emergent literature of the impact of the COVID-19 pandemic on healthcare utilization, this study is the first to collect information on prevalence and prevention behavior of organic producers and can serve as a baseline for future studies. Future studies should center on understanding the circumstances that impact and influence organic farmers' prevention behavior. This information is essential for the allocation of resources, health education, and policy aimed at ensuring appropriate food supply and supporting organic farmers. Thank you for your time and attention. This work was made possible by a grant from the Southwest Center for Agricultural Health, Injury Prevention, and Education. References are available upon request.